Hello everyone. If you suffer from a type 1 sliding hiatal hernia, you're among probably 85 to 90% of hiatal hernia cases. But if you suffer from a type 2 paraesophageal hiatal hernia, then that is a little bit more complicated. And we're going to talk about that right now because she has a type 2 hiatal hernia. And again, she's amongst maybe 5 to 15% of cases are type 2 or higher. Okay, you can just relax your legs down there. So what I'm doing here, this is her second treatment. Type 2, 3, and 4 hiatal hernia account for 5 to 15%, as I said, of hiatal hernia cases. A type 2 hernia results from a localized defect in the phrenoesophageal membrane, while the gastroesophageal junction remains fixed to the pre-aortic fascia and the median arcuate ligament. So type 3 hernias have elements of both type 1 and type 2. With progressive enlargement of the hernia through the hiatus, the phrenoesophageal membrane stretches, displacing the gastroesophageal junction above the diaphragm, thereby adding a sliding element to a type 2 hernia. So in a way, type 2 hernia has elements of type 1. Now, we're not going to fix her type 2 hiatal hernia. We're not going to cure a type 2 hiatal hernia with this maneuver. By the way, this laser doesn't fix or cure it. It just reduces the inflammation, makes the maneuver a little bit easier for her, okay? The natural history of a type 2 hernia is progressive, and the enlargement so that the entire stomach eventually herniates with the pylorus juxtaposed to the gastric cardia. And this can form an upside down intrathoracic stomach. And either as cause or effect, paraesophageal hernias are associated with abnormal laxity of the structures, normally preventing displacement of the stomach. So the gastrosplenic and gastrocolic ligaments are affected, and as the hernia enlarges, the greater curvature of the stomach rolls up into the thorax. And because the stomach is fixed at the gastroesophageal junction, the herniated stomach tends to rotate around its longitudinal axis. And she also has scoliosis, an S-shaped scoliosis. And what ends up happening is it creates a gastric volvulus, and that could lead to acute gastritis or obstruction or incarceration or worse, perforation. So we did the hiatal hernia maneuver on her, and how did you respond? You traveled here all the way from Massachusetts, by the way, right?
Yes.
And I'm in New York, so she traveled pretty far to see us, and we worked on her, spent some time with her last weekend. And how'd you do after the first treatment and only treatment?
I have been doing fine. I was feeling better and I was breathing better. But since 2 days ago, I started feeling like a little bit more of reflux again.
Okay.
But
You were doing well for
I'm
a few
doing
days?
better for a few days, yeah.
Okay.
Most of the days of the week, yeah, the last week.
Okay. So we're going to go ahead and do the maneuver again, but we have to be very gentle with her. And she also understands and has the right expectations, I think, and understands, what our limitations are. Obviously, if it's a sliding type 1, that can be corrected. Type 2 is different, and 3 and 4 and so on. And we're going to do another video soon that gets into all the different types with diagrams, and we'll really get into it a little bit more and explain all the different ones. But typically we spend more time on type 1 because that's the most common type, so we don't spend as much time on type 2, 3, and 4 hiatal hernias. Okay, are you ready?
Yes, I am.
Okay. And just relax yourself just like you did last time. So when you're doing this, sometimes you'll feel pulsating. And that pulsating is the abdominal aorta. And actually the abdominal aorta is deeper and slightly lateral, just slightly lateral and behind the stomach and the esophagus. So once you feel that pressure, you should lighten up.
Mhm.
Good. Any soreness here when I do that? Oh, you're tolerating that a lot better today.
Yes.
So being that she lives in Massachusetts, it makes it complicated. I'm assuming you work during the week. So if you're working during the week, it makes it hard for you to get down here during the week. And what we're doing here is just managing her symptoms, because the other options are not great for her. And we're also addressing her scoliosis as well. You okay there?
The back pain
Back pain?
when you are
When
pushing like in this area from
Okay.
here to down here,
Lower back pain?
in the
Okay.
points, in the points that you touched me.
Okay.
before.
Yeah, and her back is very sensitive. She's hypersensitive. So we're going to work on some scoliosis stretches for you. Relax. Yeah, it's going to be a little bit uncomfortable. Good. Okay. Okay, now we're going to do one last one, right? We're going to get under that rib cage a little bit more. Good. Good. Okay. Breathe in and out. So a lot of people describe having pain or difficulty breathing. And it's kind of the opposite of what many people think. When you actually take a deep breath in, it's hard because your diaphragm is supposed to lower, right? When you breathe in and you have your lungs filled, your diaphragm lowers. And when you breathe out, it comes up. Okay. So some people even have a hard time breathing out as well. Do you have a hard time breathing in and out? Yeah?
A little bit, yes.
Just relax here. Okay? I'm just here to help you, okay? Relax yourself and wiggle your toes for me. Good. And this one's not going to be nearly as bad.
Oh my goodness.
And deep breath in and all the way out. Okay. So I think we should do a few things here. I think we should probably connect you with either a PT or a chiropractor in Massachusetts to deal with your scoliosis and your lower cross syndrome. And that will only help with the hiatal hernia stuff. And as far as dealing with that, we'll have to find somebody that can help you with that if you can't come here regularly. I understand that if you're unable to, but I think getting regular help 2 to 3 times even a week for all your back pains. I know you didn't come to me for that, but your back is very sensitive, and that needs to be addressed. And it does affect your hiatal hernia. Your stomach is connected to your spine via the anterior longitudinal ligament. Excuse me. So, thanks for tubing in, folks. But let's have you stand up, and actually, let's just have you test it right now and see. Okay. Go ahead, stand up. Take a breath in, see how that feels. you doing? Okay?
I'm good. Yeah.
Do you have the acid reflux right now? Did you have that when you came in?
Yes.
Yeah, she did. Okay. All right. Again, thanks for watching, guys. If you have any questions, comment below. See you soon.